Assalamu alaikum guys. I hope you all are fine and doing great. So today we are back with the lecture number 7 of the dental pharmacology lecture series. ठीक है? So today's our topic is periodontal dressing. So basically, what is a periodontal dressing? These are used to protect the wound created by the periodontal surgery and to maintain the closed flap adaptation to the bone and the teeth during the initial stage of healing. So basically, it is dressing which is done when after a periodontal surgery. Okay, when you have raised the flap. Okay, so to maintain the initial stage of the healing. Okay, what are the characteristics of the acceptable dressing materials? So following are the characteristics of the acceptable dressing material, which include basically it should be non-toxic and non-irritating to the tissues. It should be conveniently be prepared and placed and removed and with the minimal discomfort to the patient. This is the main point. Okay, and it should maintain the adhesion to itself and to the teeth and the tissues. Okay, it should not stain or damage any restorative material. This is a very much important point. Okay, so what is the purpose of this periodontal dressing? The purpose is to provide the mechanical protection for the surgical wound and therefore facilitate healing. Okay, and it prevents post-operative bleeding by maintaining the initial clot in the place. This is a very important thing, and it supports the mobile teeth during the healing. So it can be also used for the mobile teeth as well. Support provide mobile teeth. Okay, it helps in shaping or modeling the new deformed tissue. Okay, it provides patient comfort by isolating the area from the external irritation or injuries. Okay, what are the types of the periodontal dressing? There are following types, which include basically the eugenol dressing, non-eugenol dressings, fat-containing dressings, cyanoacrylate dressings, non-asbestos dressings, and light cure dressings. Okay. What is eugenol dressing basically? Basically, the basic ingredients in it includes there is a powder and there is liquid. The powder includes zinc oxide, powder rosin, tannic acid flakes, asbestos fibers for added strength. Liquid includes eugenol, olive or peanut oil, and antiseptic is thymol is antiseptic. Okay, in it. What does the brand names under it comes? Basically PPC and Wards Wonder. Okay, what are the characteristics? It is hard, brittle, and hard to mix and breaks easily. Can be prepared in quantity and in stores in work size pieces. Maximum powder must be incorporated in there to achieve a thick mix. Okay, what are non-eugenol dressings? Basically, the basic ingredients includes the base, accelerator, and various bactericidal and bacteriostatic agents are also added. Okay. What are the brand name? Brand name includes Copac and Peripac. Okay. Causes defects after repositioning of lab covered by a non-eugenol dressing. So you can see that this is also defect which is covered after repositioning of lab with the help of non-eugenol dressing. What are these characteristics? It should be pliable, it should be smoother, it must be prepared at the time it is used, it can't be prepared in advance and used. Okay. Fat containing dressings, basically it contains antibiotics such as bacti, cetirizine added to zinc oxide and rosin powder. Okay. Cyanoacrylate dressing cause irritation to the connective tissues. Okay. Non-asbestos dressings, good multi-purpose dressing, cause minimal irritation, uh, is easy to handle, can be made in large batches divided into small portions, wrapped in foil, kept refrigerated until needed. Okay. Light cure dressing, basically light cure dressing include basic ingredient in syringe. Brand names includes baric acid, and characteristics non-brittle, very elastic, no mixing is required. Okay. Application of light cure dressing, it is placed basically directly into the mouth from the syringe or indirectly off the pad. Device surfaces adjacent to the surgical sites. Place the pack on cervical one third and margin of the wound. Remove the excess with a plastic or a Vaseline lined instrument and expose each segment light for curing time 10 seconds to check occlusion and placement. Application of a hard dressing and soft pack dressing. For the hard pack, to achieve a putty consistency, mix maximum amount of powder into liquid to achieve a putty mix. Need so consistency is firm and thick. For soft pack dressing, extrude equal lengths and quickly mix together until blended. Use Vaseline or gloves to form the pack. If these are open embrasure with the missing papilla or recession, use small section of dressing to mold into the wedge shape to press interproximally. Apply one use strip starting from the distal and placing on the facial and lingual. Press interproximally and with the plastic instrument adapt around the gingival surface and interproximal areas to gain retention. For protection and promotion of healing, The dressing should not exceed 1 to 2 millimeter beyond the surgical side. Any edentulous area may be filled to make dressing continuous. Dressing should not interfere with muscle, cheek, and frenum attachments or in order to prevent movement or dislodgement of dressing. So this is a very important point should know. So you can see in this case the dressing in maze here. Okay, well placed dressing here in as well. Frenum should move freely. Overextension causes irritation. Uh, Check occlusion. Dressing should extend only to the height of contour of teeth. Should not be in the occlusal contact during closure. So these are the points you should kept in mind while making the dressings. Okay. Characteristics of a well placed dressing. It should be secured and rigid. The first thing is movable dressing promote bleeding and irritation. So this is a point you should remember. The little bulk as possible is locked interdentally, so it can be displaced by the tongue, cheek. Uh, it can't be displaced by the tongue, cheeks, or lips. Okay, cover all the surgical wound and interdental areas without unnecessary over extension. Okay, should have smooth surface to prevent irritation and discourage plaque retention. This is a very much important one you should keep in mind. So these were all the characteristics of well placed dressing. I hope that today's lecture was uh, uh, not audible to you and you learned from it. So with this, our today's lecture ends. Thank you very much. Allah Hafiz.